What causes nondisjunction?
If you remember from cell division, normally we should have all our homologous chromosome pairs pair up and divide nicely into the two cells, whether they're sperm or egg. And what happens with nondisjunction is that the two chromosomes pair up and then they don't divide, they both go into one cell. So you have an extra chromosome in one cell and a missing chromosome in the other cell. We don't really know why it occurs. We know that it's extraordinarily common in humans. For example, of all spontaneous abortions, half of them have chromosome abnormalities and half of those are caused by nondisjunction. So it's a tremendous problem in humans, and we have some theories of why it occurs, like there hasn't been enough recombination between the chromosomes to hold them together, so there's no longer anything holding them together, so they fall apart and just randomly go into a cell rather than going in an ordered manner. But we're not entirely sure of all the possible reasons.
All these threads here represent the chromosomes lined up at metaphase 1 of meiosis.
Okay.
What would happen with nondisjunction?
Well, assuming that anaphase 1 occurs normally, the chromosomes will divide as they should. But when we get to anaphase 2, we'll assume that these chromosomes still separate as they should, but over here, when nondisjunction occurs, these chromosomes fail to separate. So what we end up with are two gametes, one with one extra chromosome and one with one less. Now, if either of these two gametes are involved in fertilization, then in most cases the embryo will be miscarried.
Okay, that's a little clearer. Good.
One of the biggest outcomes is pregnancy loss, because having a whole extra or missing chromosome is a bad thing for a cell. It can't handle that much extra genetic material or that much missing genetic material. So the biggest outcome is pregnancy loss, and that can be spontaneous abortion. It can be pregnancy loss even before a woman knows that she's pregnant, so before implantation. It can lead to a stillbirth, and it also can lead, a small proportion, to live-born babies that have congenital abnormalities and or mental retardation. There are different syndromes depending on what chromosome is extra or missing, and probably the most common syndrome that most people would know about is Down syndrome, which is an extra chromosome 21. Other ones that we see in live-borns are an extra number 13 or number 18, and these are much more severe than Down syndrome. About 90% of these are dead by a year because they have severe congenital malformations. Some of the milder ones include the sex chromosome. So if you have missing X chromosome, that's Turner syndrome, and these girls are completely mentally normal but have infertility. They're sterile so that they can never have children. And sort of like the opposite of that is Klinefelter syndrome, where a male has an extra chromosome, an extra X chromosome. He's male, but again is sterile. One of the biggest factors that we know to be associated with nondisjunction is increasing mother's age. So, for example, if a woman of 20 has a risk of about 1/1500 of Down syndrome, whereas a woman of 40 has a risk of about 1 in 100. So you can see there's a big increased risk there. So one thing that people can do is have children when they're younger. And another thing is there is the possibility of prenatal diagnosis. As a woman ages, we can take a sample of the cells surrounding the baby and tell if the baby has trisomy 21 for Down syndrome or any of the other ones as well.